Hello, good morning everyone. Today we will talk about the effect of sensory stimulation, acupuncture on sympathetic and parasympathetic activities in healthy subjects. Okay, introduction. It has been postulated that sensory stimulation, acupuncture, affects the cardiovascular system via the autonomic nervous system, ANS. And we have already known that ANS is consisted of sympathetic and parasympathetic nervous system. The performance of cardiovascular system can reflect in HRV, and the HRV allows an analysis of the interaction between the activity in the sympathetic and the parasympathetic nervous system. So, what is HRV? HRV is heart rate variability, and it can be measured by ECG and the power spectrum analysis, PSA. And the LF, low frequency, and the HF, high frequency, components of HRV can be calculated reflecting the sympathetic and parasympathetic activity, respectively. Okay, the 合谷 point, Li4, in the thenar muscle, which is innervated by sensory fibers and the autonomic, mainly sympathetic fibers. On the other hand, the conch of the ear represents an area which is mainly innervated by sensory fibers and autonomic, mainly parasympathetic fibers. Participants: 12 healthy volunteers, 6 men and 6 women, mean age 34.4. They were divided into 3 balanced, randomly distributed sessions, Session A, B, and C. Session 1. The needle was inserted perpendicular into the ear point, LU1, that is worry point, in the left inferior hemiconch. Session B. The needle was inserted perpendicular into the 合谷 point, Li4, in the middle of the right dorsal thenar muscle. Session C. The needle was inserted perpendicular, superficially into the skin, overlying the 合谷 point on the left hand. But no needle sensation was evoked during Session C in order to evaluate the importance of the needle sensation. Therefore, the superficial needle insertion was considered as a technique of control. Methods: pre-stimulation period of 50 minutes was followed by needle insertion. During Session A and B, the needle sensation was evoked and recalled every 5th minute during a stimulation period of 25 minutes. At that, it was post-stimulation period of 60 minutes. Furthermore, throughout the whole period, HRV was measured. Results. Result 1. In the LF power, Group A, the ear stimulation caused no significant changes. Group B, the thenar stimulation caused a significant increase both during the stimulation and the post-stimulation period. Group C, the superficial needle insertion caused a significant increase only during the post-stimulation of 60 minutes. Result 2. In the HF power, both in Group A, the ear stimulation, and Group B, the thenar stimulation, caused a significant increase both during the stimulation and the post-stimulation period. Group C, the superficial needle insertion caused a significant increase only during the post-stimulation period. Result 3. No significant changes were observed in systolic and diastolic blood pressure was observed during group A, B, and C. Result 4. A significant decrease was observed in heart rate during group B, the sinus stimulation, after the post-stimulation period of 16 minutes. Okay, summary results. According to the table, we can see that the ear stimulation caused a significant increase in HF, both during the stimulation and the post-stimulation period, indicating the increased parasympathetic activity. The sinus stimulation caused a significant increase both in LF sympathetic and HF parasympathetic activity during the stimulation period. Furthermore, an even more pronounced increase was observed in HF parasympathetic activity during the post-stimulation period. The superficial needle insertion caused a significant increase both in LF sympathetic and HF parasympathetic activity during the post-stimulation period. Okay, discussion. No matter the He point, which is innervated mainly by sympathetic nerve fibers, or the ear point, which is innervated mainly by parasympathetic nervous fibers, the acupuncture induces a significant increase in the HF component of HRV, reflecting the parasympathetic activity. Possibly, this can explain the relaxation, calmness, and the reduced feelings of distress commonly experienced by the patients. Okay, let's come to the conclusion. Sensory stimulation acupuncture in healthy persons is associated with changed activity in the sympathetic and the parasympathetic nervous system, depending on 1. the site of stimulation, and 2. the period of observation. Thanks for your attention.